Hello everyone. So here is one of my short little videos around information. Before I get into the information, I want to establish something that's quite important. Remember that you are a unique individual with your own unique issues, and those unique issues around your diagnosis, your medications, or your whatever is troubling you is yours, and it happened in a unique environment. So most of the time we can generalize to other people, but remember, you are unique and you're finding information for your unique situation. Number two, if you are getting information from a healthcare professional and you're not sure, you can check and go more deeper to make sure that they are registered and licensed. Some people do ask me about, well, how do I know this? Where do I report this? So we do have something called the Regulated Health Professions Act, which actually talks about who can have a license in what profession in healthcare. And so nurses are one of them, physicians are the others, but there's other ones like physiotherapy and respiratory therapy and registered massage therapist and dentists and midwife and psychotherapists and so on. And so always a good idea to check out, are these people registered, licensed? I'm licensed. You can check it out. You can plug in my name and it tells you how long I've been a nurse. So that just puts your mind at ease that they are licensed and registered. And most of the time, it's very rare, I think, to find that they're not. However, it has happened. If you feel like checking it out, go ahead, do it. Now, the other information that you may want to check into or want to know is, where am I going to get this information from? And the other thing is, if you have been given a diagnosis or maybe this is what it is, and there are a number of things you need to get done, it's life-altering, or you need to have major surgery and so on. Some things are cut and dry, some things may not be, or you may wonder, is this the right thing to do? How do I do? Or when you have to make up a very difficult decision. If it's not an emergency, you can, and I would recommend that you get a second opinion. And this is Tango. He likes to be around when I'm doing any videos or any Zoom calls. So he will be our little video cat. He likes to, I guess he wants to teach, I don't know. But you can look up all this information online with respect to who is registered and who is not registered. I just lost my train of thought because of you bum. The other thing is, as you have a right to have a second opinion. So you can request and say, I give permission and I will sign consent that you send my information to the choice of the surgeon or specialist, and I would like for them to give me their opinion. And sometimes the physician may recommend someone, or you may have someone in mind that you just would like to have that opinion. And that's just to give you peace of mind if you require or you're not sure. And that happens sometimes. And even families may question, especially if it's a child or if it's an elderly, is this the right thing that we're doing? So number one, you can check out who's registered and licensed. Number two, you can have a second opinion. Number three, getting information or finding out more about it. So you can go to Google. It's very common. Obviously, most of us do that. And so do patients. And sometimes it's a little bit of okay, hold on a second here. Lots of information. And nurses and doctors don't necessarily like it. They like it that you're educated and you educate yourself. However, you have to remember the information that's on, let's say, Google or some of the WebMDs and whatever is good information, but remember, it is for the general public and it's general information. It will give you a whole bunch of symptoms or a whole bunch of reasons why something is happening. And we are all unique individuals and we all have unique circumstances. So you cannot say that particular whatever they write down is exactly like yours, because they will give you from the worst case scenario to the most minor scenario. And usually everybody's in between somewhere. So, or none of it is true. So please be mindful of that and not to, if you get scared easily or you get anxious, I recommend you talk to someone else rather than read things that then might scare you, which makes it even worse. The other thing is that these general pages are not so bad to maybe point you in the right direction. However, what you can do is you can go to specific organizations that specialize in, let's say, arthritis, brain injury associations, and there's provincial and federal ones, and these are all not-for-profit organizations. You can go to like Enterostomy Society. There's just, all of them have it, Alzheimer's Society, and so on. They have tons of good information. They also will have a list of specialists that they may recommend or that you can go to. And they will also talk to you, and they may have educational sessions and or pamphlets or more information. So I recommend that if you do have something specific you're concerned about, that's actually a really good place to go to. Now, having said all of that information and bringing it all together, one of the most important things to remember is that if you are still confused or you're not sure, or you want to go somewhere else, or you're not sure about how the process works, and you need more help, or you need a translator even. But I'm thinking more about, what are the steps? Is this the right steps? What do I have to do before, after, whatever is happening? You can also hire a nurse navigator. And I've done it here and there because I've been teaching, but there are some really good nurses in Ontario that do this. So I can list their businesses, and you can certainly hire some of them to actually help you and advocate for you to figure out, where am I going to go, what's next. And some will actually go to the doctor's office with you and explain and educate you on what they're telling you. So use your resources wisely to decrease the anxiety and actually really be present, so you know what's going on with you and you get the right information at the right time for the right reasons, so that whatever the issue is, it gets resolved easily and effectively and fast, so that you don't worry. And no matter how you look at it, we live in the information age, so there's lots of good stuff out there. Have a great evening, have a great week, and we'll see you next on another info blip, info second, info minute. Oh, Piroska's info minute.